This Medical Monday is sponsored by the George Washington University Hospital.
Well, today we'd like to bring attention to a medical condition that's particularly common in women, but you may not even be aware of it. So here with more details is Dr. Noureldine. He is an endocrine surgeon at the George Washington University Hospital. Welcome to Good Morning Washington.
Thanks for having me.
So we're talking about thyroid nodules today. Doctor, how common are these in women?
You are right that they are common in women. 1 out of 4 women will have a thyroid nodule. And that nodule could be a functional nodule where it overproduces thyroid hormone in large amounts where it can affect the quality of life of the patient. It can be a benign nodule, however, it can grow over time and cause compression on the vital structures of the neck where patients can have difficulty breathing or difficulty swallowing, or it can get to the point where it is so big that it's cosmetically unappealing for patients and it's easily seen on the neck. Fortunately, less than 5% of thyroid nodules are cancerous nodules. Yet in 2025, we're expected to have 44,000 new cases of thyroid cancer, of which 31,000 are going to be in women.
That's really scary. So what does the traditional treatment look like for thyroid nodules?
Traditionally, for a functional thyroid nodule or a benign thyroid nodule that is big and is affecting the quality of life of the patient, or even for malignant nodules, we usually take those patients to the operating room, subject them to the operation, and remove their thyroid. And that entails them undergoing general anesthesia. And we know for some patients that's something that we can't take lightly in them. And we are concerned of how they can recover from it. And despite our efforts to make this operation as delicate as possible, it's still, the patients will still require time to recuperate and recover from this operation, needing time away from their family, their loved one, their kids, and time away from work. And by removing the thyroid gland, we're removing that source of thyroid hormone for the patients, subjecting them to the need to take thyroid hormone medication, a pill, for the rest of their life. So you can see there's an upside where this is treatable and we can improve the quality of life of patients, but there are downsides to that treatment as well.
Absolutely. So the whole reason we're here today is you have a special new innovative treatment. Please share all about it.
Yeah, so at the GW Hospital over the past year, I've been able to work closely and collaborate with experts in the field to bring an innovative new technology to our community. It's called radiofrequency ablation of thyroid nodules, or RFA, and it's a procedure that does not require general anesthesia, and it involves sticking a needle inside that nodule. That needle has electrodes at the tip of it where it generates heat, and that heat can burn the thyroid cancer. And for those big nodules, it generates an inflammatory response where the body starts eating and chipping at that nodule to shrink it over time. It's a procedure that is 30 to 40 minutes. We numb the skin. The patients are comfortable and usually chatting with us while we're doing it. Once we're done, they go home 10 minutes afterwards, back to their daily routine without any restrictions. And some just take a pill of a Tylenol that day, and that's about it.
That's it?
Yeah.
That's amazing. So with not having surgery and this new RFA procedure, what are the long-term benefits that you're seeing? So
for every procedure, there has to be a balance of 3 things: the right patient, the right disease process, and the right proceduralist or surgeon. And with thyroid surgery, it's a definitive operation. We're removing the thyroid, but no operation is without any risks. And specifically with thyroid surgery, there's a lot of vital structures in the neck that can be injured during this operation, especially the nerves that go to the voice box, and some patients can have voice changes after this operation. This is specifically important because 90% of thyroid surgery in the US is done by surgeons who do less than 5 of these procedures a year. And we know that volume correlates with outcomes. With thyroid RFA, we're just focusing on the thyroid nodule itself, where we are treating it and we are able to restore the quality of life of the patient without affecting the remainder of the thyroid. So after the operation or that procedure, they will not need to take thyroid hormone medication for the rest of their life. It involves just a needle stick rather than an incision, so there won't be any scarring in the neck in an area that's very cosmetically important for a lot of patients.
Absolutely. It sounds like an incredible procedure. Dr. Noureldine, thank you so much for your time today. I really learned a lot.
Thank you for having me. I appreciate it.
My pleasure.